So basically, the patient will have referred pain and in irreversible, but in reversible there will be a localized pain. In reversible, a patient will have symptomless again when it is not stimulated by the stimuli, but in this in irreversible, patient is response to a very high voltage, means a very high voltage stimuli the patient will respond to, but in reversible it will be lower than the normal voltage required for purple tissue. In irreversible, the pain not easily localized to a particular, means you can means the pain is not easily localized. It is the patient will point to a point that the whole jaw is involved in it if the patient will come to you in the clinic. Okay. Now, the carious lesion in the mandibular primary molar that might present with a reversible pulpitis. The patient may have reversible pulpitis. Okay, reversible pulpitis. Look at. Okay. Okay, histopathology. It is very important that there will be vasodilations of the blood vessels. The blood vessels will be dilated, so there will be more flow to the blood. Inflammatory cells will be less, underlining the effective dentate abuse. The dentate abuse that is infected will have less inflammatory cells. There will be odontoblastic layer will be disrupt. It will show edema due to exudation of fluid and localized may or may not present necrosis. Very important. Vasodilation, few inflammatory cells, disrupted odontoblastic layer, edema, and necrosis. You can see this is the pulp. This is dilated blood vessels. Okay, we have dilated blood vessels. Here is the edema. Okay, basically these are blood vessels. Okay. Okay, histopathology, and these are we have the plasma cells and all the cells we have in this. This is a lymphocyte. Okay, you can see lymphocyte we have in this also. We have actually the plasma cells. Okay, the cells are here. Look at. Okay, there diagnosis. First you will do examination. Either might be when it comes the patient will come to the clinical, so we'll do physical examination. We'll examine the intraocular examination. Either will be caries, traumatic occlusion, pain, the history of pain either will take, and how it is stimulated. Then you will do x-ray of a normal period or the caries. Percussion you will be doing, very important, with the shank or handle of the mouth mirror. Vitality response readily to cold or either electric truss, less current to cause pain. Okay, treatment. No RCT is needed. If it is irreversible, you have to do, but in reversible, you don't. You have to just do the fillings, remove the cause, set a pallet of cotton with the anol for 5 minutes or zinc oxide agenol as a temporary filling you will do. Protect the pulp from further thermostabilization. Placement of a sedative dressing in the carious defects for a week, and after 2 to 3 days you will do the final restoration. Now to irreversible pulpitis. The pain is less intense, but it is not sure, but it is a dull constant pain, spontaneous, initiated not with a stimuli, lasts for more than 30 seconds, which you have said associated with the declines, means there is more pain when the patient is supine position, not easily localized, and referred pain, you can say what you have said. Now here they have said you have two stages. One is early stage, which is acute. Another is late. In the early stage, irreversible, the pain often be localized easily to the individual offending, means the pain is localized in early stage. The tooth responds to electric pulp testing at the lower levels of current, but later the pain is increased intensively experienced. It has a throbbing pressure that keeps the patient awake. One very important thing, when the patient has the irreversible pulpitis, especially, the patient will have the pain will be throughout the night. So the patient cannot will be couldn't sleep at that night. So if the patient give you the history, so he will say that due to pain I couldn't sleep throughout the night. So it is a very important clinical that you have to take proper history. At this point, it means the heat increases the pain. However, cold may produce relief. Very important. You should know what is the relieving factors in this. Patient is unable to identify the offending tooth within a quadrant. So basically, the patient will refer. The patient couldn't localize that tooth that is paining. He or she will say that he will pointed the whole jaw as a pain. Matlab the whole jaw is paining. At high levels of the current no response. It is very important, you can say. It is relieving by cold, means it is in later stage irreversible pulpitis. Later stage irreversible pulpitis. Histopathology is same, you can see it. There will be a necrotic zone, demonstrate conjunction of venues that results in focal necrosis. There will be congestion, there will be focal necrosis, necrotic zone, or leukocytes and histiocytes surrounding pulp usually shows a fibrosis or mixture of the plasma cell. There will be inflammatory cells. Okay, these are xenophils, basophils, and neutrophils. Okay, moving towards next. Again, deep carious lesion, pain history, not relieved by analgesic. Okay, then there will be a deep extent of caries. Normal period but slight widening will be in advanced stages. Period will be normal but widened. You have to do RCT or AR extraction. Okay, some comparison again. Reversible elicit sharp less than 20 minutes. An effective pulp position easily localized. Spontaneous dull more than 20 minutes, affected by tooth body position and difficult to localize. So then there was according to the acute and chronic pulpitis. We will discuss inshallah.